our next founder, Ashley Barrow from Reassist. Drawing on over 2 decades of experience as a care coordinator, Ashley witnessed firsthand how siloed IT systems and overlapping coordinator roles created duplicative work, unclear responsibilities, and delayed discharges, ultimately burdening both patients and providers. Reassist is designed to solve this problem. The platform uses AI-empowered human-in-the-loop technology integrated with EHRs to scale referral tracking, communication, and care planning. By automating social determinants of health screenings, referrals, and authorizations, while still keeping providers at the center of decision-making, Reassist frees clinical staff to focus on what matters most: patient care. Its recommendations incorporate location, financial circumstances, and service needs to match patients with the right providers faster, reducing hospital readmissions and improving quality of life. Please join me in welcoming our next presenter, Ashley from Reassist.
Hello, everyone. How are you doing today? My name is Ashley Barrow. I'm the founder of Reassist. I'm also a care coordinator of 20 years. And so I'm here to share with you today our billable coordination platform for high-risk patients. So meet Dr. Williams. Dr. Williams is in a rural county. She's got a large patient panel. She sees about 20 patients a day. 30% of her patients are high need. These individuals are aging, they're disabled, they have socioeconomic issues, they're chronically ill. And simply, it's just when they come into the office, it's really hard to take care of these individuals or coordinate their care in addition to the clinical visit that needs to happen. These individuals come in with discharge follow-ups from hospital system, chronic care needs, social care navigation. They need to get connected to home care, which requires forms and processes and nuances. And this just doesn't fit into clinical workflow. It could take 1 to 2 hours to do any type of coordination for this patient. So what happens? The coordination gets delayed or pushed off. The doctor doesn't get paid because it's kind of hard to scale care coordination. And then Nancy here, the patient, her needs get delayed. Now, if you want me to go down that rabbit hole, what that looks like, I don't think we have time for that, but when her needs get delayed, it's all types of trouble. So what did CMS do about this? They did something major. They developed a code called Advanced Primary Care Management. This is when doctors can actually make money for the coordination in between visits that they have not typically gotten paid for or able to scale. At $110 per patient per month, they can bill for these high-risk patients. To qualify, the patient does need to consent and they have to have a chronic illness. The gaps are, it's still that manual process with the coordination that takes forever. So you need tools, you need infrastructure, and that's when Reassist comes into play. Reassist is an AI-empowered human-in-the-loop platform that integrates with the electronic health record. It identifies the need of the patient, develops care plans, helps with the task dashboard, and writes this back into a billable document into the electronic health record. So how do we work? We work in 2 different ways. We can provide the software for a team that's robust enough to take this on, or they can completely outsource the software and the service to Reassist. At about $60, this can be functioning in a clinic today. So how does it work now? Nancy's here. She's getting her clinical update, her visit done. The doctor addresses the clinical need, and then she does a warm handoff to the auxiliary personnel or anybody that can do the coordination work inside of the clinic. If they can't do it, again, they can outsource it to Reassist. So what does that look like for a high patient panel that has about 30% of their patients, let's say 2,000 patient panel, 300 patients? That doctor, when was losing money, will now make about $200,000 extra a year. The market is huge for AI infrastructure around coordinated care. It's about a $2.2 billion market. Primary care alone is at $1.1 billion. We believe we can get to $20 million. So the difference between us and other platforms is we have a robust provider directory that works and analyzes the electronic health record and basically allows the patient to be able to have personal needs addressed. And that's something that we haven't seen anybody else do. So that's our differentiator. We also have a service component, which is exciting. And finally, we are coordinators and we've built this device for coordinators. So market traction today, we just got finished with a usability and validity pilot through Case Western Reserve, which was super exciting. Harvard has helped us with a lot of the things we've done. We're starting to build deep integrations through the Athena One proprietary APIs, which we'll be able to read and write back. We're going to be doing marketplace advertising and quick onboarding for those individuals that are interested. We have 1 contract and we have 50 in the pipeline. Here's our team. Again, my name is Ashley Barrow, CEO and founder, coordinator for over 20 years. We have everyone on our team have experience in care coordination. We have collaborated with some wonderful researchers in this area, connected to some hospitals in Case Western Reserve. And also we're connected to a strategic network, including the people here at JumpStart. So what we're asking for is introductions. We need introductions to individuals that want to increase their service line. If they're primary care doctors and they're interested in learning more about how to make money efficiently, introduce us. And then also for those hospitals that are connected to primary care doctors, if you're looking at artificial intelligence as a solution to administrative burden, let us talk to you about with your AI committees and see if we would be a good fit to start. We'll finish our 3 pilots, and then eventually at the end of the 4th quarter, we'll start raising. We'll be raising for product expansion and also sales and get deeper, more robust integrations with like the Epic customer, et cetera. So thank you very much, and I'll take any questions.